Disease and poverty are very closely linked, and disease can, of itself, cause poverty. This is usually a result of unexpected and unplanned health costs, which arise when an individual falls ill, so-called catastrophic healthcare costs. On the other hand, good health can reduce poverty. Adults in good health are productive. They earn money which benefits their families and communities and ultimately the economy of the country. Children who are well can attend school and are more likely to make a greater financial and social contribution to their families and their communities in the future. So what are these healthcare costs? How do they arise? Becoming unwell can be expensive. Health costs might include tests such as blood tests and x-rays to make a diagnosis, travel to hospitals or clinics, hospital admissions, surgery, dressings and medicines. At the same time, days off work and disability mean pay is lost for both patients and their carers. Poorer families are affected to a greater extent than better off ones by unexpected and unplanned health costs, because they are much less likely to have savings to pay for unexpected health costs. They have no safety net and may be pushed into poverty by these costs. A number of studies have identified that these so-called out-of-pocket or OOP healthcare payments are important predictors of financial hardship and poverty. So if disease could be prevented and the burden of disease on poorer populations reduced, could poverty be reduced? This has indeed been shown to be the case, and this is where vaccines make a significant contribution to the fight against poverty. It has been known for some time that vaccination has made a greater impact on global health to date than any other medical intervention. But it is only recently that it has been possible to show that vaccines can also reduce poverty. A study published in February this year demonstrated that, as well as saving 34 million lives, childhood vaccine programs for 10 common diseases could prevent 24 million people falling into poverty by avoiding the costs associated with these vaccine-preventable diseases. The greatest benefits of vaccination were among the poorest, suggesting not only that poorer people are more vulnerable and have a higher risk of developing vaccine-preventable diseases, but also that the impact on their lives is potentially greater. The cost of preventing disease with vaccination programs is cost-effective and is usually lower than providing treatment for vaccine-preventable diseases. Vaccine programs deliver value for money, and for the governments of low-income countries, this is an opportunity to show what they could achieve in terms of improving health equity and reducing poverty by targeting higher vaccination rates in poorer and more marginalised communities. However, there are scientific and social challenges in developing and distributing vaccines which can slow their progress. For every extra year that a new vaccine takes to be licensed in poorer countries, tens of thousands of deaths may occur that could otherwise be avoided, and many more are pushed into poverty. The major challenge to developing new vaccines for the low and middle income countries is financial. Most vaccines are developed by the pharmaceutical industry, who may not be able to recoup the high cost of development, especially if the vaccine targets a disease found only in poorer countries. This can be overcome to some extent by organisations such as the Bill and Melinda Gates Foundation and Gavi, the Global Vaccine Alliance. Both of these are global organisations who contribute financially to the development of vaccines. Vaccines must, of course, be affordable to poorer countries. The second biggest challenge is prioritising which diseases to target with the development of new or better vaccines. This requires a better understanding of the burden of disease each potential vaccine could prevent, which in turn needs good disease surveillance or public health systems with a robust structure to detect cases of diseases and experts to understand the impact of different diseases on individuals and communities. Finally, the vaccine itself and the programme to deliver it must be acceptable to local leaders and local populations and must be sensitive to religious and cultural needs. Vaccination programmes must be fair and sustainable in order to build trust. These challenges can and must be addressed if vaccines are to make their greatest impact on both health and poverty, for example, by establishing better public health systems to understand the burden of disease and prioritise the development of the most relevant vaccines. Secondly, by reducing manufacturing costs. This may be achieved by vaccine manufacturers in emerging economies such as India and China, who are increasingly able to produce high quantities of good quality, low-cost vaccines for poorer countries. Thirdly, more research is needed into new vaccines that are more effective, require fewer doses to produce a full immune response, and are cheaper to produce. This requires the development of innovative vaccine technologies. And finally, partnerships between academic research, industry, governments, funding bodies and communities are vital for accelerating the development of vaccines and making the best use of the resources available.